Hi, my name is Dr. Lemo. I'm a naturopathic physician who has a practice solely focused in cancer care for over 20 years. Um, what I want to talk about today is glutamine and cancer. I'm finding with seeing patients and with social media is that there's this assumption or belief that glutamine is not considered a favorable ingredient in cancer. Part of this has been kind of stimulated with the work of Dr. Thomas Siegfried, who's been pioneering an approach, a metabolic approach to cancer, where, for example, restricting glucose, which could feed cancers, or glutamine, which is a potential fuel source and more ketogenic, could have some potential impact in cancer. So what's important to highlight is a lot of that work is based on laboratory, looking at the cancer cells in the laboratory or mouse, versus the human body is different. So, for example, the body naturally makes 60 to 80,000 milligrams per day of glutamine. 60 grams to 80 grams per day, it makes it naturally. It's an important amino acid that's involved in supporting the immune system, tissues, muscles, all parts of the body. So when you're then, and which is one of the reasons why glutamine is used in a lot of people in performance and exercise, and people go to the gym, those kinds of things. In the area of cancer, there actually is a lot of human data supplementing with glutamine to help in the tolerability of standard of care cancer treatments, radiation, chemotherapy, surgery, as an examples. So, for example, glutamine can be useful with radiation in head and mouth cancers, and radiation in that area decrease sores. There's papers with surgery and improved surgical outcomes. There's papers with chemotherapy and they say the taxanes and less side effects. So I think what the confusing part is for the general public is when you're incorporating standard of care treatments, the body needs help. It needs assistance. It's trying to keep the gas tank full with glutamine, which can be helpful for you in keeping the body strong to also help to fight the cancer. Versus when you're looking at the work by Dr. Siegfried and others, this is more in the laboratory, in the test tube, not factoring in these other factors of the support around those cancer cells. So the issue then becomes for those who have concerns about this area of the metabolic treatment of cancer. When you're doing standard of care treatments, you could supplement with glutamine, and then when those are finished, for example, then you could stop and continue on, a metabolic approach to cancer. For those who are in more chronic treatment or long-term treatment, say ongoing protocols, well, it's also important to keep the body strong so you can tolerate treatments better and continue treatment so that you don't have to potentially stop them or pull away from them. So keep that in perspective. In terms of negative with human use of glutamine, the only paper that comes to mind is there was a paper published in 2005, so 20 years ago, where they were using an intravenous form of glutamine along with the nutritional IV in hematological or blood cancers that were doing stem cell transplants. And when they followed them for several years, it appeared that those who had the glutamine group maybe didn't do as well as without. So that's the only paper that comes to mind from what I've seen. And so I guess there could be some, in theories, for some hematological cancers, there could be some concern. But when you look at the vast literature, it's like a lot of the human data, what it basically overwhelmingly shows, either it helps you with standard of care treatments and tolerating them better, or it doesn't. But it doesn't say hurt you. and that includes some hematological cases in children with like mouth sores. And anyways, so again, with this whole the issue of glutamine and cancer, the metabolic disease concept treatment for ongoing use is one thing, but when you're doing it with standard of care treatments, chemotherapy, surgery, radiation, and potentially immune system based treatment, it could help you, it could support you. And for those then who have concerns about it, you just stop when it's over or done.